Welcome to HEALTHe Newfoundland and Labrador. This HEALTHe NL education and training module will provide you with information regarding the patient dynamic summary, including an overview of the medication profile, the patient context bar, allergies and adverse drug events, devices, medical conditions, pharmacy notes and the privacy override. This is the patient dynamic profile. This is the summary screen for a patient once you have selected them from a search or work list. The dynamic patient summary provides the following information, if available, about a patient: the healthcare number, of which only MCP is currently available. Demographics, including physical and postal address if provided. Any available phone numbers will be displayed. Allergies summary. Adverse drug event summary. Alternate names. The patient context bar is visible once a patient has been selected and placed in context. The patient context bar displays information about the patient you have selected from a search or work list. Work lists. This allows the user to place a patient in a work list. Patient information. This area will display the patient details and includes patient identifier, last name, first name, middle name, date of birth, age and gender. The years field may display as days, weeks, months. If the patient is deceased, a label with that indication will appear to the right of the patient gender. Context. This will show the user a list of the patients that was returned from the search performed to view the patient currently in context. Previous and next. These will take the user to the previous, or next, patient in the search results list, as provided in the context list to the left. Patient summary. This icon will take the user back to the patient dynamic summary screen, the first displayed when a patient is selected from a work list or the results of a search. Allergies. This icon opens the allergies and adverse drug event summary screen. Medications, 4 months and 2 years. These icons open the medication profile summary page for the respective lengths of time. You can find further detail regarding a patient's medication profile here. Links for the 4-month and 2-year medication summary screens can also be found on the left-hand side. Medical conditions, devices, and pharmacy notes. These links will open the summary screens for the respective information. Further detail relating to each type of information can be found here. Privacy override. If a patient has a privacy directive placed on their record, this link will take you to the privacy override screen. Additional detail regarding this function is provided towards the end of this module. The allergy profile is a component of the dynamic patient summary, shown on the patient summary page. Additionally, the allergy profile alone can be accessed by clicking on the allergies icon in the patient context bar. The allergy profile data includes records for both allergies and adverse drug events or ADE. The allergy summary windowlet displays the following active allergy details: the allergy agent, the severity and reactions of the allergy, and the reported date the allergy was entered into the Drug Information System, DIS. To view a summary display of a particular allergy or adverse drug event, select an information field from the allergy or ADE you wish to view. The allergy details screen and the adverse drug event details screens provide additional details relating to that particular allergy or ADE. The devices profile is a component of the dynamic patient summary, and can be accessed by clicking on the devices icon in the patient context bar. The device summary allows the user to view a summary listing of the patient's dispensed medical devices. Each row in the device summary presents an aggregate of data about the device prescription and each associated dispense, if any. Device data is sourced from the NL Drug Information System, DIS, and is sorted by date, with the most recent device reported. Clicking on the prescription icon in the left hand of the row will display the prescription details screen. Clicking on any row of the device summary displays the device dispense detail in a pop-up window. If there is no dispense information associated with a record, the following screen will be displayed. The medical conditions profile is a component of the dynamic patient summary, and can be accessed by clicking on the medical conditions icon in the patient context bar. The medical condition profile consists of a summary that allows the user to view a summary listing of the patient's active medical conditions. Medical conditions are sourced from the NL Drug Information System and is sorted by date, with the most recent condition reported. Clicking on any row of the medical condition summary displays the medical condition detail in a pop-up window. The medical condition detail displays the detailed record information for a medical condition. The pharmacy notes section is a component of the dynamic patient summary, and can be accessed by clicking on the pharmacy notes icon in the patient context bar. The pharmacy note summary allows the user to view a summary listing of the pharmacy notes related to this patient's pharmacy network health record. Pharmacy notes are sourced from the NL Drug Information System. Clicking on any row of the pharmacy note summary displays the pharmacy note detail in a pop-up window. The clinical data presented in the dynamic patient summary may be restricted or limited due to information privacy directives present on the patient's electronic health record. When clinical data is protected by an information privacy directive, it is said to be masked. If records are masked, the clinical portal user is informed with a message that data is not shown due to privacy restrictions in the area of the page where data is normally expected to appear. As seen on this screen, once you enter the medication summary, both 4 months and 2 years where data exists, you will see the restrictions here as well. If necessary, you can override the privacy directive. Start by clicking the Privacy Override icon in the top right-hand corner of the patient context bar. Users can override privacy restrictions by receiving patient consent from either a patient or delegate and entering the keyword. Users can also override privacy via Break the Glass and will be required to enter whether the action is an emergency or based on professional judgment. Both patient consent and Break the Glass privacy overrides are audited. However, Break the Glass functionality will generate additional auditing. When applying patient consent to remove privacy restrictions, the clinician must first choose from a list, indicating who provided consent. Either the patient or a patient representative. Once the clinician has indicated who provided consent, they must then select the consent mechanism, either physical presence or verbal. Finally, the clinician will enter the keyword provided by the patient or patient representative and select the override button. In the absence of patient consent, an example of this may be an unconscious patient, clinicians can use the Break the Glass function to temporarily remove the privacy restrictions from the patient's record. The clinician can enter one of two choices for the Break the Glass function, either emergency or professional judgment. Using the Break the Glass functionality will trigger additional auditing. You have just completed the Patient Dynamic Summary Training module for HEALTHe NL. For additional education and training information and material, please visit the website provided.